Hello, my name is Dr. Hillel Mazansky, and today we are going to discuss colon cancer. In the United States, colon cancer is the third most important or most frequent occurring cancer, breast being first and prostate being second. If one asks me what causes the colon cancer, well, there are many causes, but the two most important causes, as far as I'm concerned, one, of course, is genetic, because the patients tell us that their father, grandfather, uncle, aunt had it, whatever. There is a family relationship to the disease, and therefore it's genetic. Well, it's known genetic. They've isolated the gene. But as I've said on a few previous occasions, the gene has to be what we call turned on, switched on, or activated. And to go into that discussion is rather intense and deep and doesn't belong here. Suffice it to say that one can have, that we all have certain genes that cause illness, but that does not mean that we always get the illness. Certain factors turn on the gene, and in the case of colon cancer and many other type cancers, while hereditary is there, it is stress that causes the cancer. Chronic, ongoing stress, and not only recent stress, but stress in the past, that the thought of that has already been repressed. In other words, it's so painful that the patient cannot think about it. Let's discuss a little bit about the signs and symptoms, and then we'll talk about the treatment of colon cancer. Colon cancer can develop anywhere in the large gut or the large bowel, which extends from the right side of the abdomen across the lower part of the chest to the lower abdomen, and the use for the large colon is to get rid of excessive waste, and one usually goes to the bathroom once every day and evacuates stool. So, the signs and symptoms of colon cancer, beside the hereditary fact, is the first sign usually is blood in the stool or in the bowel motion. And that is, the color of the blood is usually red, reddish to darkish red, but not that severe, intense, dark red stool called melena that patients get when they bleed from the upper gastrointestinal tract, such as the esophagus or the stomach. So it's bleeding. The bleeding is usually mixed with a stool, or the BM as we say here. It is not usually on the outside. If you have red blood on the outside of the stool, it usually indicates that you might have hemorrhoids, which, by the way, can be the first sign often of a colon cancer, of a tumor sitting higher up. I'm not going to go into the real anatomy of the stool and the causes, as that your primary care physician can help you with. But it is blood in the stools, and later on weight loss, nausea, vomiting, and then it can spread to the rest of the organs, resulting in yellow jaundice, etc. But again, we're not going to discuss that today. Your primary care physician can elicit you on that, on further details if you have questions. But what we really want to talk about is prevention. How do we all prevent ourselves from getting colon cancer? The first is, and the first most important thing, is to try and not have chronic stress. And if one does, treat it. We'll talk about that later. The second thing is to eat a nutritious diet or program, eating fruits and vegetables that are intensely deep in color, And those foods have high incidence of antioxidants and rich in polyphenols, and those are the cancer-fighting agents. Because cancer gives off oxidants or rust, and so one needs antioxidants, and that is fruit and vegetables. I am fully aware that one can go into a health food store and buy oneself antioxidants, but friends, that's not the same. Let food be thy medicine and medicine be thy food, said one of our patriarchs many, many years ago, and that is still true today. Let food be thy medicine and medicine be thy food. It's far more important to eat healthy fruit and vegetables than it is to take an antioxidant supplement. There's absolutely no evidence in the world that taking a pill, an antioxidant, is the same as eating the food. So that is the first thing, eating a nutritious diet. The next thing is exercise. And the importance of exercise is that the faster one is able to exercise, the higher the pulse rate, the more endorphins are secreted by the brain, which is a feel-good hormone. And when one feels good, one usually doesn't develop severe, chronic, and sometimes even deadly illnesses. Now we come to the treatment. Yes, of course, there's the treatment of colectomy, removing the colon, and radiation, chemotherapy, all that, but that's not what we do. So the first thing is treatment to prevent. Also, I should have mentioned, is that to have a colonoscopy. That is a special long tube that goes up the colon and looks for polyps. And if it can find a polyp, the polyps are removed, because those polyps are the precursors sometimes to colon cancer. Having a colonoscopy. The first colonoscopy is usually done here in the United States at age 50 and is repeated 2 years later again. And if both of them are negative, then one does not usually need to have a colonoscopy for 10 years if all other things being equal. I've devoted a lot of time to this issue because it is the third most important cancer, if you will. Well, all cancers are important, but occurring cancer in the United States. That's the treatment. Let's talk now of a different type of a treatment. A treatment that can sometimes help prevent the development of colon cancer. Of course, there's the vitamin D, and we've spoken about that. Now we come to how can we best handle the stress. The stress issue, generally speaking, patients go usually to clinical psychologists for counseling, or to psychiatrists for medication and or counseling, and that's fine. But how is it that they land up here at our office? It's because oftentimes that doesn't work, and the reason being that the psychiatrists and psychologists are unable to really penetrate into the subconscious mind. And if you ask any psychiatrist or psychologist that I have, are you able to get into the subconscious mind? The honest ones say no, and the others say, well, yeah, sometimes. The only way that I and medical science knows of to get into the subconscious mind, especially deeply, is through hypnosis, which, as you know, was first described by Mesmer in 1882, hence the word mesmerized. And by going into deep hypnosis, or as we call it, hypnotherapy, because it's therapeutic, one often is able to elicit what happened many, many years ago when the patient was a mere child and suffered severe trauma, psychological and or otherwise, usually psychological trauma. But the patients don't tell their therapists this, for the reason is that these ideas are being so, these happenings and occurrences have been so painful to the patient that it's called repression. They have repressed that fact into the deep, deep subconscious area of their brain. And when you ask them, did this happen and that happen while they're sort of awake, they'll say, no, they don't recollect. But once you get into the deep portions of the subconscious with deep hypnosis, all of a sudden the truth outeth. And once that has happened, then you speak to them about it. Some need further ongoing therapy. Discussing that, we refer them to group therapy for whether it's rape or whatever. They go to group therapy, and this is sometimes far better than individual one-on-one single therapy, because the patients feel close to those that are there at the meeting, and they have something common to discuss. So this is where medical hypnosis, nutrition and exercise comes into the treatment and prevention of various types of cancer, and today colon cancer. I thank you all for listening. My name is Dr. Hillel Mazansky. Thank you.